31. A client confides in the RN that a friend has told her the medication she takes for depression, Wellbutrin, was taken off the market because it caused seizures. What is an appropriate response by the nurse? A. Ask your friend about the source of this information. B. Omit the next doses until you talk with the doctor. C. There were problems, but the recommended dose is changed. D. Your healthcare provider knows the best drug for your condition. 31C. Wellbutrin was introduced in the U.S. in 1985 and then withdrawn because of the occurrence of seizures in some patients taking the drug. The drug was reintroduced in 1989 with specific recommendations regarding dose ranges to limit the occurrence of seizures. The risk of seizure appears to be strongly associated with dose. 32. A child presents to the emergency department with documented acetaminophen poisoning. In order to provide counseling and education for the parents, which principle must the nurse understand? A. The problem occurs in stages with recovery within 12 to 24 hours. B. Hepatic problems may occur and may be life-threatening. C. Full and rapid recovery can be expected in most children. D. This poisoning is usually fatal, as no antidote is available. 32b. Hepatic problems may occur and may be life-threatening. Clinical manifestations associated with acetaminophen poisoning occurs in 4 stages. The third stage is hepatic involvement, which may last up to 7 days and be permanent. Clients who do not die in the hepatic stage gradually recover. 33. A client is receiving digitalis. The nurse should instruct the client to report which of the following side effects. A. Nausea, vomiting, fatigue. B. Rash, dyspnea, edema. C. Polyuria, thirst, dry skin. D. Hunger, dizziness, diaphoresis. 33a. Nausea, vomiting, fatigue. Side effects of digitalis toxicity include fatigue, nausea, vomiting, anorexia, and bradycardia. Digitalis inhibits the sodium-potassium ATPase, which makes more calcium available for contractile proteins, resulting in increased cardiac output. 34. The provider has ordered transdermal nitroglycerin patches for a client. Which of these instructions should be included when teaching a client about how to use the patches? A. Remove the patch when swimming or bathing. B. Apply the patch to any non-hairy area of the body. C. Apply a second patch with chest pain. D. Remove the patch if ankle edema occurs. 34b. Apply the patch to any non-hairy area of the body. The patch application sites should be rotated. 35. A pregnant woman is hospitalized for treatment of pregnancy-induced hypertension, PIH, in the 3rd trimester. She is receiving magnesium sulfate intravenously. The nurse understands that this medication is used mainly for what purpose? A. Maintain normal blood pressure. B. Prevent convulsive seizures. C. Decrease the respiratory rate. D. Increase uterine blood flow. 35b. Prevent convulsive seizures. Magnesium sulfate is a central nervous system depressant. While it has many systemic effects, it is used in the client with pregnancy-induced hypertension, PIH, to prevent seizures. 36. A client with anemia has a new prescription for ferrous sulfate. In teaching the client about diet and iron supplements, the nurse should emphasize that absorption of iron is enhanced if taken with which substance? A. Acetaminophen. B. Orange juice. C. Low-fat milk. D. An antacid. 36b. Orange juice. Ascorbic acid enhances the absorption of iron. 37. The healthcare provider has written morphine sulfate 2 mgs every 3 to 4 hours PRN for pain on the chart of a child weighing 22 pounds, 10 kilograms. What is the nurse's initial action? A. Check with the pharmacist. B. Hold the medication and contact the provider. C. Administer the prescribed dose as ordered. D. Give the dose every 6 to 8 hours. 37b. Hold the medication and contact the provider. The usual pediatric dose of morphine is 0.1 mg per kilogram every 3 to 4 hours. At 10 kilograms, this child typically should receive 1 mg every 3 to 4 hours. 38. The nurse is monitoring a client receiving a thrombolytic agent, alteplase, activates tissue plasminogen activator, for treatment of a myocardial infarction. What outcome indicates the client is receiving adequate therapy within the first hours of treatment? A. Absence of a dysrhythmia, or arrhythmia. B. Blood pressure reduction. C. Cardiac enzymes are within normal limits. D. Return of ST segment to baseline on ECG. 38D. Return of ST segment to baseline on ECG. Improved perfusion should result from this medication, along with the reduction of ST segment elevation. 39. A nurse is assigned to perform well-child assessments at a daycare center. A staff member interrupts the examinations to ask for assistance. They find a crying 3-year-old child on the floor with mouth wide open and gums bleeding. 2 unlabeled open bottles lie nearby. The nurse's first action should be A. Call the Poison Control Center, then 911. B. Administer syrup of ipecac to induce vomiting. C. Give the child milk to coat her stomach. D. Ask the staff about the contents of the bottles. 39D. Ask the staff about the contents of the bottles. The nurse needs to assess what the child ingested before determining the next action. Once the substance is identified, the Poison Control Center and Emergency Response Team should be called. 40. A client is receiving erythromycin 500 mg for every 6 hours to treat a pneumonia. Which of the following is the most common side effect of the medication? A. Blurred vision. B. Nausea and vomiting. C. Severe headache. D. Insomnia. 40b. Nausea and vomiting. Nausea is a common side effect of erythromycin in both oral and intravenous forms. 41. A 4-year-old child is admitted with burns on his legs and lower abdomen. When assessing the child's hydration status, which of the following indicates a less than adequate fluid replacement? A. Decreasing hematocrit and increasing urine volume. B. Rising hematocrit and decreasing urine volume. C. Falling hematocrit and decreasing urine volume. D. Stable hematocrit and increasing urine volume. 41b. Rising hematocrit and decreasing urine volume. A rising hematocrit indicates a decreased total blood volume, a finding consistent with dehydration. 42. Prior to administering alteplase, TPA, to a client admitted for a cerebral vascular accident, CVA, it is critical that the nurse assess A. Neurosigns. B. Mental status. C. Blood pressure. D. Point/PTT. 42D. Point/PTT. TPA is a potent thrombolytic enzyme. Because bleeding is the most common side effect, it is most essential to evaluate clotting studies including PT, PTT, APTT, platelets, and hematocrit before beginning therapy. 43. A nurse who has been named in a lawsuit can use which of these factors for the best protection in a court of law? A. Clinical specialty certification in the associated area of practice. B. Documentation on the specific client record with a focus on the nursing process. C. Yearly evaluations and proficiency reports prepared by nurse's manager. D. Verification of provider's orders for the plan of care with identification of outcomes. 43b. Documentation is the key to protect nurses when a lawsuit is filed. The thorough documentation should include all steps of the nursing process: assessment, analysis, plan, intervention, evaluation. In addition, it should include pertinent data such as times, dosages and sites of actions, assessment data, the nurse's response to a change in the client's condition, specific actions taken, if and when the notification occurred to the provider or other healthcare team members, and what was prescribed along with the client's outcomes. 44. The nurse is caring for clients over the age of 70. The nurse knows that due to age-related changes, the elderly clients tolerate diets that are A. High protein, B. High carbohydrates, C. Low fat, D. High calories. 44C. Low fat. Due to age-related changes, the diet of the elderly should include a lower quantity and higher quality of food. Fewer carbohydrates and fats are required in their diets. 45. A client is to receive 3 doses of potassium chloride 10 ml equivalent in 100 cubic centimeters normal saline to infuse over 30 minutes each. Which of the following is a priority assessment to perform before giving this medication? A. Oral fluid intake, B. Bowel sounds, C. Grip strength, D. Urine output. 45D. Urine output. Potassium chloride should only be administered after adequate urine output, greater than 20 cubic centimeters per hour for 2 consecutive hours, has been established. Impaired ability to excrete potassium via the kidneys can result in hyperkalemia. 46. A hypertensive client is started on atenolol, tenormin. The nurse instructs the client to immediately report which of these findings: A. Rapid breathing, B. Slow, bounding pulse, C. Jaundiced scara, D. Weight gain. 46B. Slow, bounding pulse. Atenolol, tenormin, is a beta blocker that can cause side effects including bradycardia and hypotension. 47. During nursing rounds, which of these assessments would require immediate corrective action and further instruction to the practical nurse, PN, about proper care? A. The weights of the skin traction of a client are hanging about 2 inches from the floor. B. A client with a hip prosthesis 1 day post-operatively is lying in bed with internal rotation and adduction of the affected leg. C. The nurse observes that the PN moves the extremity of a client with an external fixation device by picking up the frame. D. A client with skeletal traction states the other nurse said that the clear, yellow and crusty drainage around the pen site is a good sign. 47B. A client with a hip prosthesis 1 day post-operatively is lying in bed with internal rotation and adduction of the affected leg. This position should be prevented in order to prevent dislodgement of the hip prosthesis, especially in the first 48 to 72 hours post-op. The other assessments are not of concern. 48. A client is scheduled for an intravenous pyelogram, IVP. After the contrast material is injected, which of the following client reactions should be reported immediately? A. Feeling warm, B. Face flushing, C. Salty taste, D. Hives. 48D. Hives. This is a sign of anaphylaxis and should be reported immediately. The other reactions are considered normal and the client should be informed that they may occur. 49. You are caring for a hypertensive client with a new order for captopril, Capitan. Which information should the nurse include in client teaching? A. Avoid green leafy vegetables. B. Restrict fluids to 1,000 cubic centimeters per day. C. Avoid the use of salt substitutes. D. Take the medication with meals. 49C. Avoid the use of salt substitutes. Captopril can cause an accumulation of potassium or hyperkalemia. Clients should avoid the use of salt substitutes, which are generally potassium-based. 50. A client has bilateral knee pain from osteoarthritis. In addition to taking the prescribed nonsteroidal anti-inflammatory drug, NSAID, the nurse should instruct the client to A. Start a regular exercise program. B. Rest the knees as much as possible to decrease inflammation. C. Avoid foods high in citric acid. D. Keep the legs elevated when sitting. 50A. Start a regular exercise program. A regular exercise program is beneficial in treating osteoarthritis. It can restore self-esteem and improve physical functioning. 51. A client in respiratory distress is admitted with arterial blood gas results of pH 7.30, PO2 58, PCO2 34, and HCO 319. The nurse determines that the client is in A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. 51A. Metabolic acidosis. These lab values indicate metabolic acidosis. The pH is low, PCO2 is normal, and bicarbonate level is low. 52. A woman with a 28-week pregnancy is on the way to the emergency department by ambulance with a tentative diagnosis of abruptio placenta. Which should the nurse do first when the woman arrives? A. Administer oxygen by mask at 100%. B. Start a second 4 with an 18-gauge cannula. C. Check fetal heart rate every 15 minutes. D. Insert urethral catheter with hourly urine outputs. 52A. Administer oxygen by mask at 100%. Administering oxygen in this situation would increase the circulating oxygen in the mother's circulation to the fetus's circulation. This action will minimize complications. 53. You are caring for a client with deep vein thrombosis who is on heparin 4. The latest APTT is 50 seconds. If the laboratory normal range is 16 to 24 seconds, you would anticipate A. Maintaining the current heparin dose. B. Increasing the heparin as it does not appear therapeutic. C. Giving protamine sulfate as an antidote. D. Repeating the blood test 1 hour after giving heparin. 53A. Maintaining the current heparin dose. The range for a therapeutic APTT is 1.5 to 2 times the control. Therefore, the client is receiving a therapeutic dose of heparin. 54. A client newly diagnosed with type 1 diabetes mellitus asks the purpose of the test measuring glycosylated hemoglobin. The nurse should explain that the purpose of this test is to determine A. The presence of anemia often associated with diabetes. B. The oxygen carrying capacity of the client's red cells. C. The average blood glucose for the past 2 to 3 months. D. The client's risk for cardiac complications. 54C. The average blood glucose for the past 2 to 3 months. By testing the portion of the hemoglobin that absorbs glucose, it is possible to determine the average blood glucose over the lifespan of the red cell, 120 days. 55. An 80-year-old client is admitted with a diagnosis of malnutrition. In addition to physical assessments, which of the following lab tests should be closely monitored? A. Urine protein. B. Urine creatinine. C. Serum calcium. D. Serum albumin. 55D. Serum albumin. Serum albumin is a valuable indicator of protein deficiency and, later, nutritional status in adults. A normal reading for an elder's serum albumin is between 3.0 to 5.0 g/dl. 56. A 66-year-old client is admitted for mitral valve replacement surgery. The client has a history of mitral valve regurgitation and mitral stenosis since her teenage years. During the admission assessment, the nurse should ask the client if as a child she had A. Measles, B. Rheumatic fever, C. Hay fever, D. Encephalitis. 56B. Rheumatic fever. Clients at present with mitral stenosis often have a history of rheumatic fever or bacterial endocarditis. 57. Which of these clients should the charge nurse assign to the registered nurse, RN? A. A 56-year-old with atrial fibrillation receiving digoxin. B. A 60-year-old client with COPD on oxygen at 2 liters per minute. C. A 24-year-old post-op client with type 1 diabetes in the process of discharge. D. An 80-year-old client recovering 24 hours post-right hip replacement. 57C. Discharge teaching must be done by an RN. Practical nurses, PNs, or unlicensed assistive personnel, UAPs, can reinforce education after the RN does the initial teaching. 58. The nurse discusses nutrition with a pregnant woman who is iron deficient and follows a vegetarian diet. The selection of which foods indicates the woman has learned sources of iron. A. Cereal and dried fruits. B. Whole grains and yellow vegetables. C. Leafy green vegetables and oranges. D. Fish and dairy products. 58A. Cereal and dried fruits. Both of these foods would be a good source of iron. 59. A client diagnosed with gouty arthritis is admitted with severe pain and edema in the right foot. When the nurse develops a plan of care, which intervention should be included? A. High-protein diet. B. Salicylates. C. Hot compresses to affected joints. D. Intake of at least 3,000 cubic centimeters per day. 59D. Intake of at least 3,000 cubic centimeters per day. Fluid intake should be increased to prevent precipitation of urate in the kidneys. 60. 1 hour before the first treatment is scheduled, the client becomes anxious and states he does not wish to go through with electroconvulsive therapy. Which response by the nurse is most appropriate? A. I'll go with you and will be there with you during the treatment. B. You'll be asleep and won't remember anything. C. You have the right to change your mind. You seem anxious. Can we talk about it? D. I'll call the healthcare provider to notify them of your decision. 60C. This response indicates acknowledgement of the client's rights and the opportunity for the client to clarify and ventilate concerns. After this, if the client continues to refuse, the provider should be notified.